Hi, I'm Teresa O'Nwere Tan. I'm an advanced nurse practitioner based in South East London. I'm very excited to have just won the award for Nurse of the Year award from Nursing Times. I think what inspired me to become a nurse is I've been a carer since I was young. So I've got a very young autistic brother, and he had lots of needs. So he needed help with like washing, dressing, feeding. And I think from that perspective, learning how to care for him made me kind of empathize and be compassionate towards others who have same vulnerabilities. Also, when I was young, I was born premature, and I was cared by many amazing nurses, and I looked up to them and thought I'd be a nurse as well. So that's what really led me into nursing. So I started nursing, let me think. I was a student nurse in 2009 with City University London, or City and St George's now is what they're called. And I did adult nursing, did that for 3 years, and then I've been a nurse for about 15 years. And basically I've been working in different areas of London, so North London, East London, and now South London. So it's really good. So when I won the Nursing Times Nurse of the Year award, I was very proud. I mean, I wasn't in the country when the ceremony came, and when I got told I won, I was in absolute shock. We don't expect as nurses to be recognized for the work that we do, so it's a really nice touch to actually have something like this. So I think what contributed to winning this award in particular was my ongoing, ambition to try and bring about proactive healthcare as opposed to reactive, because often, unfortunately, we deal with the issues when it's too late, and I used to be a heart failure specialist nurse where it's kind of the end stage of patients who had comorbidities. So I went out in the community just with my backpack and my blood pressure machines and my stethoscope, screening the public for blood pressure. Even if they never mentioned having blood pressure issues in the family, I just went out and did that, and I think it's really helped communities to understand the importance of looking after oneself, screening as often as you can. I love nursing in South East London because it's a very multicultural, diverse area. So many different cultures, so many different languages. I mean, I'm learning Spanish, I'm learning different languages, and I love it. But because of that, I feel like I can really communicate with the patients on their level very well, because I'm from a multicultural background. I'm Nigerian and Japanese, so that means being multilingual, multicultural. I know what it feels like to kind of be in kind of a foreign land and getting used to the systems and things. So I love the idea of meeting new people and helping them understand their healthcare problems. I think my role impacts patients in the wider community as an advanced nurse practitioner. So what we do is we essentially assess, diagnose, advocate for patients, prescribe medication. So similar to a doctor, but at a nurse's capacity. And I think what patients love is that we have a good continuity of care. They can see us for as many things as they like. They feel more comfortable and open to talk to us about things. And I think those in those communities who tend to not come to doctors or GP appointments, when they see people like myself, they feel confident and they feel kind of feel motivated to come and help themselves and learn more about their health issues. So the advice I would consider giving someone if they wanted to start a career in nursing, I'd say be very ambitious, be very compassionate, and learn to love yourself, because if you don't pour into your own cup, you can't pour into others. If you don't look after yourself, it's going to be hard to look after the community and everybody around you. So definitely do that.